views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
There's growing concern about the disproportionate impact of coronavirus on Black and brown people, immigrants, and others who make up the majority of Bronx residents. That's one of the many reasons the Bronx COVID-19 Oral History Project exists. This group of Fordham University students, scholars, and community leaders have a goal to capture the voices of the borough's residents to understand how they're being affected by the coronavirus pandemic. I'm Shannon, Assistant News Director of WFUV, an NPR affiliate based on Fordham University's campus. This is a special edition of Bronx Connections, a collaboration between WFUV and BronxNet to provide insightful coverage of the borough. Today, we'll hear from members of the Bronx COVID-19 Oral History Project. I want to welcome Carlos Rico, Veronica Quiroga, and unfortunately, Bethany Fernandez was not able to join us today. And I also want to welcome faculty advisor, Dr. Mark Naison. Dr. Naison is also founder of the Bronx African American History Project, which sponsors the Bronx COVID-19 Project. Now, we will get into the connection between the two initiatives a little bit later, but first, Dr. Naison, can you help us understand what are some of the systematic issues the Bronx faced long before 2019 that caused the borough to be hit so hard by the virus?
The Bronx is a place where large numbers of people who are displaced from other boroughs by gentrification or urban renewal end up settling. And many of you know that in the 1950s and 60s, there was an influx of refugees from urban renewal into the Bronx. And in the 1970s, the borough suffered disinvestment and arson. In subsequent years, the Bronx physically rebuilt. The neighborhoods that were abandoned had shopping centers, apartment buildings constructed there. But the Bronx became the center for another influx of people pushed out of other boroughs, this time by gentrification. So what you have in the Bronx is a high concentration of people who are poor, who work in healthcare, in hotels and restaurants, who work in the subway system, who work in the city government. And also, it has a disproportionate number of people living in crowded households, often 2 or 3 generations living together. Now, this makes for a very strong feeling of community, but in the case of this pandemic, it created tremendous vulnerabilities. You had overwhelmingly the Bronx population that was working age took subways and buses to work. They were essential workers. They were in our hospitals, our nursing homes, home health aides, running the subways and buses, doing the cleaning in all the office buildings. And then they're coming back on public transportation to households where you had no chance of social distancing. So the pandemic just hit this borough really hard and overwhelmed its hospitals, which were overwhelmingly public hospitals, and which lacked the fundamental equipment to care for the patients coming in. There wasn't enough PPE, there wasn't enough ventilators, and so the death rate skyrocketed in the borough because of all of those conditions.
Now, this question is for either Carlos or Veronica. Who are some of the people that you guys interviewed, and why did you choose them?
So, as Dr. Naison mentioned, some of the most critical population that we really wanted to focus on were essential workers, people who were still commuting back and forth to work, because we really felt that it was important to just highlight the experience of Bronxites in the middle of a global pandemic. And what's the best way to do that? Besides showing the resiliency, basically just showing what their day-to-day life is like, still commuting to work. So one of our interviewees, Patricia Hernandez, is part of the working class. She lives in the Tremont area of the Bronx and spoke about her experience. She was a T-Mobile worker at the time, which at the time for some reason was considered essential. So her stores never closed. So Patricia was traveling back and forth via the D train every single day. She spoke about living in a household with 4 other people, 2 bedrooms. Her mother's actually also a home health aide. So she also spoke about the fears and anxieties of having not only herself having to commute back and forth from work, but also her mother, and just all the fear and anxiety that was sort of just living in her household for so long.
Yeah, she sounds like one of the essential workers that I want to get into in a minute. But first, I want to know, so how did you choose the people?
So the most important process, I would say, when choosing people was we wanted it to be done on a voluntary basis, which means we didn't want to interrupt or sort of overstep, because these are people that are already facing so much inner trauma and are already dealing with the day-to-day traumatic experiences of having to work and live in the middle of a pandemic. So the last thing we wanted to do was impose ourselves and impose our sort of project onto people who were just too busy or just not in the right mental and physical state to do it. So we chose people who were interested in sharing their story. We chose people who we knew, who we felt stories needed to be highlighted. But it was all done on a very voluntary basis.
Yes.
So we are actually still taking more interviewees day by day, and yeah.
Yeah, one of the things, although I did none of the interviewing, this is a project entirely started by these 3 students, Veronica Quiroga, Bethany Fernandez, and Carlos Rico, and one other student, Allison Rinney, who interviewed Fordham students who were studying abroad and were forced to come back, suddenly during the pandemic. This is an entirely student-run initiative, but I did help identify some people who were real leaders in the Bronx who I thought would be valuable. One of them, who Carlos interviewed, was Maria Aponte, a famous poet, somebody who organizes nonprofit groups in the Bronx, and a Bronx resident who took public transportation to get to and from her home to Fordham, and also lived right near Montefiore Hospital, which was one of the epicenters. So Carlos, agreed to interview her. What was that experience like for you, Carlos, interviewing Maria Aponte?
I mean, to pull a quote or a phrase, she took me to school, you know what I mean? She really showed me the power, and she emphasized this throughout the entire interview, the power of the spoken word, and how adamant she was in the unifying ability of it and the ability to come together as a community, no matter what is going on outside, it's what's going on inside. And she talked about her experience with the 60s and 70s and her involvement with the protests back then, and her community work through Latinas 50 Plus, which is honoring and empowering women over 50 and who are Latina in the community, whether it be in education, lifetime achievement, and other things. And what she emphasized was that the focus of action should be on the uplifting and of our community organizations who are doing good in the community. And she was telling me different people that she knows, her neighbors or who are a part of her nonprofit, that would just be doing little things. So if they knew there was an essential worker living next door, they would make dinner for them and then say, here, let's put it outside your door. Or, oh, you don't have a mask? Okay, we're gonna have some of these people, sew one up and then put one outside your door, just like that, and make sure everything was nice and tidy. So there's this familiarity, there's this unity, and there's this resilience that is so present in the Bronx that I kind of had a knowing about, through Dr. Naison's course and, being involved with the BAHP for a little bit. But it really didn't come into my full understanding, right, until I actually sat down and talked to someone who was living through it, who has had these experiences, and listening to her story. And it was so powerful to hear. Made me want to sit down and write a poem, something like that. It was very inspiring.
Yeah. Now, there's also one of the people we interviewed was Maribel Gonzalez, and Bethany was the person who interviewed her. She owns a great Puerto Rican restaurant and cultural center on Westchester Avenue called South of France. And what's fascinating is the connection between her and Maria Aponte. Maria Aponte had a fundraiser through her Latina 50 Plus organization for South of France, because this is an invaluable community resource that during the pandemic was delivering food to people in need, you know, as well as trying to keep a business alive through takeout. And Maribel's interview is so incredibly powerful. It's about how even people in trouble in the Bronx help out other people in more trouble. And it's a beautiful, beautiful thing to listen to.
It sounds like the theme here is, you know, people helping people, community coming together. And one way it seems the community came together also is when healthcare workers were still sacrificing themselves, so to speak. These healthcare workers spent hours around sick people without social distancing, which experts say, you know, helps prevent the spread of COVID-19. So did anyone from the Bronx COVID-19 Oral History Project interview a healthcare worker?
So Bethany and I had the privilege of interviewing Miss Marlene Taylor, who works in, well, she worked throughout various hospitals in New York City, but was currently working actually in a clinic that provided free services for people without healthcare, with healthcare insurance, and for anybody really. So anybody could go into the clinic and request services or start seeing doctors there. The only problem was that because it is a clinic that provides all these free services, the hospital was very, very overpopulated at some point. And she talked about her experiences still commuting to work and just her fears of bringing the virus back home, where she lives with her husband and her son and her younger son.
So Go ahead, Mark.
No, and she has underlying conditions, and her husband does. And she's going to work every day by public transportation and seeing desperately ill patients who depend on her enormously.
Speaking of that, Veronica, did she share with you what her main concerns were when it came to her own personal health and her family?
Well, one of the main things that she was concerned about was her younger son, who was actually going to school in, I believe, Howard University
in Washington.
So that was one of her main concerns in the beginning of the pandemic, just making sure. And she also has another son who lives abroad in Europe. So
in Luxembourg. Yeah.
So her children were her first and foremost concern. And then secondly, it was just obviously bringing the virus back home and the lack of preparedness that the hospital faced and that her and her coworkers faced. So in the beginning, it was just everything was up in the air regarding how they were going to see patients, regarding the new telehealth systems that a lot of hospitals were implementing. And then the other thing was just how she was going to maintain that strong connection and that bond that she had built with so many of her patients, who were now calling her and leaving her endless voicemails. Marlene, please get back to me whenever you can. I'm really worried about this new virus. I have this underlying pulmonary disease, or I have diabetes. So, I mean, these were people who were more than just patients, random patients that she saw once or twice and then never interacted with again. These are people that she built very lasting bonds with, people who relied on her for more than just their medicine or their refill for a prescription. They relied on her to listen and as a friend. So, yeah.
But it's the same thing with Maribel Gonzalez. There are all these regulars in the restaurant who are almost like the equivalent of Marlene Taylor's patients. That you have this you know, these community institutions, like people go to the same bodega, they eat in the same restaurant, they see the same, you know, primary care physician. And that's the way people hold it together in this very crowded, high stress, you know, center of New York.
Did Maribel happen to see any business decline because of the virus?
I mean, she had to lay off some of her people because, you know, you're basically doing a takeout business where people pick it, in most cases, pick it up. Though she would bring it to some of her, you know, her customers who were homebound because they were afraid. There were a lot of people afraid to leave their apartments. I mean, you know, especially older people. There are people who've never left their apartment for 3 months, you know, senior citizens in the Bronx and elsewhere. So her business, you know, suffered a sharp decline, but she's holding it together, you know, by enough people, you know, doing takeout to support her. And then, you know, this GoFundMe campaign, which Maria Ponte is, you know, is leading. And that brings us to another person we interviewed. And this was Veronica and Bethany, Derek Lewis, who is heading this amazing initiative called the Bronx Community Relief Effort.
Can you share that, Veronica? Can you share his story?
So the Bronx Community Relief Effort was something that he put together literally in the middle, right when the pandemic hit. He was thinking of sort of brainstorming ways that he could utilize his experiences and utilize the work he's done in the past to now shine light on his home borough, the Bronx. So he said, you know what, the most important thing for me, technology, access to technology. He spoke about the gap with Black and brown residents versus wealthier residents of the Bronx, and that access to technology. So the Bronx Relief Effort was working to not only distribute food, masks, and PPE during the pandemic, but also to give out iPads and Google Chrome laptops for children in the Bronx who were now distance learning and who needed these resources. The most important thing, the Google Chromes came with access to internet. So students didn't necessarily need Wi-Fi in their own homes to now use these laptops.
Mm-hmm. And he also, part of the program is small business relief. I mean, because you desperately need to help the Bronx's small businesses, which, you know, like south of France, are reeling as a result of this. All the restaurants, you know, the small grocery stores, the little phone stores, which immigrants depend on for communication with their home countries. All of these businesses, which provide essential services, are reeling during this crisis.
Dr. Naison, can you help us understand what required the Bronx to be one of the areas that has struggled financially? Can you give us a little history on that and the reason why the virus has impacted us in the Bronx even stronger is because of some of these underlying conditions that have been there for a while. So yeah. What was going on?
I mean, the Bronx was always a borough of immigrants. In the 1920s and 30s, it was overwhelmingly Jewish, Irish, and Italian. Unlike, you know, Brooklyn, Staten Island, or Queens, the majority of its housing are multiple dwellings or apartment buildings. So you had lots of people, you know, from different immigrant backgrounds living together. In the 1940s and 50s, the Bronx had an influx of African Americans, West Indians, and Puerto Ricans into, you know, these Jewish, Irish, and Italian neighborhoods. And for the most part, that process occurred peacefully. But then in the 1950s and 60s, they had all these urban renewal programs in Manhattan and large, including the construction of Lincoln Center and Fordham Lincoln Center. And, you know, tens of thousands, possibly hundreds of thousands of people were displaced, and most of them were pushed into the Bronx. And these were people And this occurred at a time when New York's economy was changing. Factories were closing or moving, out of the city, out of the country. So you had a large influx of poor people into the Bronx at a time when jobs were diminishing. And that led to a deterioration of the housing stock, middle class flight, and then the infamous, disinvestment and arson crisis of the 70s. Then the Bronx began to rebuild and was hit in the 80s, mid 80s by a terrible drug epidemic, the crack epidemic, which, even though the communities were being rebuilt, caused great hardship to its people. In the late 90s, the crack epidemic diminished. The Bronx became safer, the building continued, but you have another influx of people coming from Manhattan, Queens, and Brooklyn, because New York is becoming an epicenter for global investment. And rents are going up, properties are being purchased in what were once working class neighborhoods, and people again pushed out. And where do they come? Into the Bronx. So there are four major new immigrant populations in the Bronx. One, Dominican. And many of the people who are coming from a Dominican background were people pushed out of Washington Heights and inward by gentrification, and they moved into the West Bronx, from High Bridge to Morris Heights to University. The whole western part of the Bronx now is very heavily Dominican. Then another very large group was West African. West Africans used to settle in Harlem as their primary location, but in the last 20 years, Harlem has become gentrified. Rents have gone up, and now the Bronx is the residence of choice for people from West Africa, well over 100,000, also settling in the Western Bronx and in the Morrisania neighborhood. Then you have a large influx of Mexicans who have been pushed out by gentrification in the Lower East Side, in Bushwick, and in East Harlem. And finally, you have an influx of people from Bangladesh who are being pushed out of Queens by gentrification. So all these folks are moving to the Bronx, and a lot of times they're moving, as extended families and are living in multi-generational households. And these are all working people. These are people who are doing a lot of the work that makes New York run behind the scenes, in healthcare, in transportation, in the office buildings, and the hotels and restaurants.
These are the essential workers.
These are the essential workers. Many of them are paid not much above minimum wage. Many of them take public transportation to and from work, and they're living in crowded conditions. So it's a perfect storm for this particular disease to really hit them hard.
And it also seems that with the Bronx being one of the poorest congressional districts and having so many essential workers, you would hope that they would have the ability to work effectively if they had to work. But I was told that some of the essential workers actually lacked masks or protective gear that was required for them to do their job and remain healthy. So Veronica, Carlos, did you find anyone or interview anyone who was struggling with wanting to do a good job, but also, concerned with their own health care?
So I actually interviewed both Wendy Akroa and Marisol Duque. So both of them essential workers. Wendy Akroa works in the healthcare industry. She works with insurance and just making sure that everyone's insurance company is paying up. The hospitals in the area. She lives in Westchester County, which was one of the first hot zones before the Bronx was declared a hot zone. They had their little installation area and little quarantine area as well, right before the Bronx did. And Marisol Duque works at a supermarket on the Lower East Side, where she was also commuting to work back and forth almost every single day. So both of these women spoke about the lack of preparedness that their jobs faced in the beginning of the pandemic. So Wendy Akroa spoke about there only being one elevator in her office building, and the fact that there were over, I think she said over like 150 people that worked in the building at different times of the day. So her main concern was just really how is she going to get to her office every single day.
Yeah.
And then her husband actually also had the virus very early on, and then she also had it as well. So it's unclear whether or not there's any correlation between that and the lack of preparedness, but she's very sure that it had to do with the fact that in the beginning, her job, they weren't offering any masks, gloves, etc., just basically putting it all on the employees to get that on their own. And then Marisol Duque also spoke about a similar experience at her supermarket, unfortunately, which is, well, I won't say the name of the supermarket for privacy purposes because she didn't either in her interview. But it's a big chain supermarket, right? So it's a fairly well-known supermarket. And she was just surprised for a supermarket that sort of brings in so many people and everybody goes to the supermarket in this neighborhood. How could you not protect your employees, you know? I mean, there were no gloves. She spoke about wearing the same pair of shoes for a month straight and just literally taking her shoes on and off right at the front door of her apartment before stepping in because that's how unprepared they were. And I mean, this was also at the point where it was very difficult for people to get masks and gloves, order them online if you didn't already have it. So for her, that was a big concern.
And I want to talk, you touched a little earlier about the Bronx COVID-19 Oral History Project also having people who were out of the country. So these Bronxites that were out of the country when COVID hit, how did they handle watching the pandemic spread while they were away from home, away from friends, away from family? And what kind of news was different between what they were hearing as opposed to what was actually going on?
Well, I listened to both of those interviews, and what it seemed was that these were, some of the people, most of the people were in Europe, a couple of Latin America. Initially, nobody in Europe was taking it, even in Italy or Germany, were taking it all that seriously. Oh, you can kind of, don't worry, it'll just pass over, forget it. But some of their relatives in the US were pressing them, you better come home. And then Fordham said, you have to come home. But I think basically there was this tremendous sense of disbelief everywhere that this was going to be as bad as it was going to get. Even in Milan, Italy, where Allison was, a week before all hell broke loose, her fellow students who were Italian said, don't worry, you shouldn't leave,
Who's Allison?
Allison Rennie, who was the person, she's a Fordham student who did the two sets of study abroad students who returned. She was the one who did those two interviews, and she also works with Carlos on maintaining the website. So I think that the pandemic just took everyone by surprise. And, it turned out northern Italy quickly became a terrible hot zone. But a week before it, the students there, the Italian students were relaxed about it. And so the suddenness of all of this, and then when it hit the Bronx, it just hit it so hard. To me, the tragedy is what was going on at places like St. Barnabas Hospital or Montefiore or Einstein, which is suddenly deluged with these deathly ill people. They don't have the rooms, they don't have the equipment. The doctors and nurses don't have the right PPE. So there are all these people who died because they couldn't get health care quickly enough when they were hospitalized. And then there's the nursing homes and senior centers. So, this is really an incredible tragedy.
Well,
No.
switching gears here a little bit, we are in the midst of not just a pandemic, but almost a civil uprising. Did anyone from the Bronx COVID-19 Oral History Project speak with anyone who is or was part of either Black Lives Matter or part of the police department?
So I interviewed Deontay Santiago, who is the president of the Black Student Alliance at Fordham University. He was attending several protests in the Bronx, Black Lives Matter protests, in addition to a community cleanup that happened in the Bronx. So just another example of resiliency and Bronx residents coming together to help, I guess, or to help. Meanwhile, they're the ones that need the help. They're still out here trying to figure out ways to sort of help and engage with the people of their community. So
Veronica actually helped organize the community cleanup on Fordham Road and even got Fordham to donate equipment to help.
Yes, Fordham did donate several cleaning supplies to us. So Deontay Santiago, that was a very touching conversation because he spoke about his experiences as sort of the president of the Black Student Alliance at Fordham and what that means. It's more than just let's have a whole bunch of panels and figure out what Black people experience at Fordham. No, he spoke about the actual effects of the pandemic being amplified, and he spoke about all these systemic injustices being amplified by the coronavirus and how he could make those two things meet, or what intersecting points could he best use to build off of and to keep the momentum going, not just from people in the community and not just from Fordham administration, but nationwide.
And I want to ask, I'm going to get a little personal now, and I want to know how the virus has impacted each of you. For example, I know Veronica, you just graduated from Fordham, but didn't get to have the traditional ceremony. So how you doing?
Well, I was very devastated at first. I'm first gen in my family, so the accomplishment was more so for my family members. It was for my mom, my grandma, who have never witnessed that, at least here in the United States. So not being able to walk across Keating steps, it hit hard, but I can only look forward to better days. The virtual graduation was very touching because it was personal. It was just close friends and family. My mom and brother surprised me the night before and decorated my entire room. So it was thoughtful. I think that there are some small sort of lights at the end of the tunnel and sort of small silver linings that you have to appreciate during these times.
And Carlos, how are you adjusting to what may become the new normal?
Being in Florida, this new normal looks like it's going to hold on a little bit longer. But other than that, it's touch and go at times. I feel like it has been for a lot of people, and it's been a period of time of reflection. And for myself, a lot of renewal. Being a part of this project, I feel like has reaffirmed me in what I would want to do with my career and what I would like to pursue in life in terms of what I want to do. And taking
what
that.
What are you going to do?
And well, I'm a student, but what do I want to do? I want to continue to uplift the stories of those who are marginalized, of those whose voices aren't heard, of boys who have the name Carlos, but don't necessarily look like me, and they don't have the same opportunity to share their stories. What does that mean? In working with this project, right, and seeing, through the community, we're going through a renewal of what would we want to see in our communities? Who are the leaders that we want to look like? What funding should go where? Who should we support? Where should funding be reallocated? What do we want our communities to look like? And, while economic inequality has bared its ugly teeth with, COVID-19 in the Bronx, right? We have seen, the power of the spoken word, as Maria Ponte said, of what needs to change and what needs to be done. And I'm so thankful for Veronica and Bethany and Nyasa and Allison and Peter, right? All the members of the project for sharing me their stories. I'm learning so much from them. And the greatest education I've received is listening to their stories, the stories of the people of the Bronx, and the education of the spoken word of the stories. And I have faith in them, and I'm thankful for them, and that we will get this change done, that change will happen, and it will be done through people like us who are willing to share their stories and share our word.
And Professor Naison, the Bronx, sorry. Professor Naison, the Bronx African American History, no, switch those two, sorry. Professor Naison, the Bronx COVID-19 Oral History Project is part of the Bronx African American History Project. So can you shortly explain what that is?
Okay, 18 years ago, I was contacted by the chief archivist for the Bronx County Historical Society, who said that community organizations, schools, and churches in the Bronx were contacting them because they wanted information about Bronx African American History Project, Bronx African American history, and they didn't have information to provide. So I was asked to see if I could create a database that the community could rely on for information, and there was nothing there. There weren't dissertations, there weren't books. So we decided to start an oral history project, to have people who were African American, who had lived in the Bronx a long time, start to tell their story so we could flesh out what this community looked like and what its experience was. And the first person I asked to do this was a former student named Victoria Archibald, who grew up in the Patterson houses in the 50s, when public housing was this wonderful place to live, filled with great services, multiracial, and it contradicted everybody's stereotypes about the Bronx, about public housing. And so we ended up publishing that interview, but then all her friends started contacting me. Dr. Naison, when can we tell our stories? What people say about the Bronx has erased our experience from the 30s, 40s, and 50s, when the Bronx was a place of hope and opportunity for Black people moving from Harlem. So we started like doing 3 interviews a week. Fordham's academic deans decided that they would assign me student workers like Veronica and Carlos to help record and transcribe the interviews, because they realized something amazing was going on. And it just kept spreading because so many people wanted to tell their stories. People from a neighborhood called Morrisania, which was the largest Black community in the Bronx in the 40s and 50s, started contacting us. People from the Northeast Bronx, where there were small communities of Black homeowners. And it just kept building and building till we've now done over 350 interviews. Everything is digitized and preserved in a Fordham Library database. People from all over the world, consult this for their research. We've published like 4 or 5 books based on it, newspaper articles, TV shows. But this project is unique because it was all started by students. All the other interviews were done by the professors. This is different. This is the students doing the interviews and the professors behind the scenes trying to support them. And this fits in perfectly with what's going on in the country with Black Lives Matter, which is a youth-led movement led by high school and college students. And so my role is very different. I'm not the leader. I'm the backup for these great student leaders. I'm the person who tries to make sure there's funding for them, who, if any, to try to make sure they have opportunities to talk about what they're doing, to try to help them, get into grad school or law school when they apply. So, this is another reason for me to stay healthy. I'm 74 years old, but, somebody needs to back up these great young people, and while they lead the revolution that's going to make this a more just country, a more just borough, and a more just university.
Carlos, Veronica, Dr. Naison, thank you so much for joining me today.